I wanted to thank the meeting organizers for the opportunity to speak today, and I'm very proud to represent Equalize as well as LSU Health and the broader New Orleans community and being a startup here within this area. So my name is Sunny Kim, and I'm the founder and CEO of Chosen Diagnostics. And our mission, if I can find the slide, advancer, is our mission is to provide healthcare solutions for preemie babies that are safe, dependable, and tailor-made. So preemie babies have long stays in intensive acute care, and gut diseases in preemies incur $3 billion annually in healthcare costs, and they have unsatisfactory outcomes. Chosen is a diagnostics company that was formed to change this. So our maiden product is Neck Detect. It's a novel diagnostic assay that is disease-specific and can be used in neonatal intensive care units. This this is the first clinically specific and accurate assay for necrotizing enterocolitis, or NEC. NEC is the most common gastrointestinal disease in preemies. It's also the most common cause of death in their first 2 months of life. So this is a new market area, and we also believe it's a lucrative one. The total market potential is over $1 billion. So currently, doctors and nurses do not know who will get NEC, when they will get it, or if they will survive it. The fundamental medical problem is that late and inaccurate diagnosis is tied with surgery and a mortality rate that jumps to 60%. Clinical progression from suspected to severe disease occurs in days or hours. You don't have months or years to figure out what's happening. So the primary diagnostic tool is currently X-ray, and it's been so for nearly 70 years. It unfortunately only identifies 44% of true positives in advanced disease. So at this point, it's too late to save the baby from death, intestinal surgery, or a life of chronic complications due to a surgically shortened gut. So our goal was to develop a test that actually improves sensitivity, is going to determine whether the disease is occurring at an earlier stage, and also lower the number of X-ray radiation exposure that these preterm infants have. So if you compare the ideal biomarker properties on the leftmost panel with our JAMA paper data of 136 infants in the blue box, you can hopefully see that there's no other biomarker assay that comes close to matching our accuracy and precision of Neck Detect. In addition, we uniquely can determine the disease 3 days earlier than X-ray. So these data, we argue, would collectively de-risk our technology. We have other products in the pipeline for premature infants. One is Neck Predict. It can identify infants that require surgery or who are candidates for therapeutic clinical trial enrollment. So we have additional good news. Neck Detect has received an FDA breakthrough device designation and it affirms that Neck Detect is a clinical game changer. Our products are protected by 3 different patent families. No, I've got it wrong. I'm looking at the wrong slide. I'm sorry, I've gone backwards. Hang on 1 second. I'm looking at the wrong display here for which slide I'm looking at. I apologize. So yeah, so the products are Neck Predict. Let's see what I've got here. And so, and then we have, we can distinguish our clinical products, Neck Detect and Neck Predict, from other competition in the marketplace. So hopefully you can see on the right panel that we are the only ones that can accurately detect disease in preterm infants. We are not confounded by other common comorbidities. And if you think about what our competition may be in the marketplace, incumbents and substitutions only look at general inflammation. Insurgents will look at probiotics, which have no associated risk with NEC. So as I was saying, we have good news that Neck Detect has a breakthrough device designation from the FDA, and it helps define us as a clinical game changer. So our products are defined by 3 different granted patent families. Chosen has exclusive rights to the first-generation utility patent that covers key technology and methods of medical use. The second is a recently granted fence patent that covers methods for disease risk assessment. The company also has been filing its own applications for antibodies and other key reagents. So in a bottoms-up calculation, the US has a market size of 380 million. These numbers double when including the EU as an initial serviceable market, but we believe we can do more. Although our initial addressable market is NEC, components in our biomarker panel have unique applications that can segue into markets with larger patient populations. So for example, our technology can be used for IBD in children as well as adults. So in addition to the clinical benefits, as well as the IP portfolio that we have, our tests can actually benefit the end users and the hospitals that care for them. So our tests can save $720 million, and this is a favorable decrease from the current $3.2 billion spend. So compared to current diagnostic costs, our target price is not a barrier to entry. We propose that the total testing cost of $2,380 per at-risk infant who is monitored for 60 days. The selling price of one test is $140 based on cost-benefit analyses in DRG models. In comparison to the $5,440 that's currently spent on an average 17 x-rays taken per preterm infant, we argue that NEC Detect pricing is reasonable, especially given our superior diagnostic specificity over x-ray imaging, and the fact that our test has no downstream health risks associated with radiation. So I'm really fortunate to have a committed team with a range of lift experience at Chosen Diagnostics. I'm the founder, CEO, and lead scientist. Rebecca Buckley and Keslin Joseph, who are in the crowd, and I hope you speak with them, are here representing Chosen Diagnostics. Becky is the PI of our 2 federal Phase 2 SBIR grants. We also have deep industry experience. Gail Page and Robert Doss have careers in clinical lab diagnostics in industry at both the national and global scales. So our go-to market strategy has focused on the introduction of NEC Detect at the beginning of 2026. And our timeline highlights that we have capital-efficient processes and a roadmap for our B2B product development. You can see here that we had $3 million in SBIR grants from both the National Institutes of Health as well as the National Science Foundation. We recently received a Phase 2 NSF award as well. So the NIH grants have really allowed us to employ clinical studies within the patient population. And so we've had 3 different studies that have enrolled 452 infants in 5 different hospitals. The NSF applications are really to help us engineer scalability of these tests so that they're accessible to people around the country and around the world. So we anticipate completion in the next 6 months of the prototype build for manufacturing, as well as for sprint discussions with the FDA to cement down our clinical trial protocols. So worldwide, more than 100,000 babies are born each year who suffer from necrotizing enterocolitis. We're excited about providing the first-in-class and best-in-class aid in order to diagnose this deadly disease. With your support, we can change the paradigm of gut disease detection and make life-saving innovation a reality. Thank you for your time and attention.
I think we have time for one question.
How are you targeting health payers? Because they're the ones who actually deal with a lot of NICU babies. One of the things I'm looking at this is that if you can really show the value that you're avoiding millions of dollars in cost, the test is, it can be worth cost. You can charge higher prices if you're going to avoid, hundreds of thousands of dollars of a NICU baby, which makes a health payer cry.
Excellent points. So I'll start with the last one. Yes, we could charge more. We have had consultants from well-known companies who are part of their reimbursement teams, and we've been told that our price point should be $900 per test. Part of it is maybe some of the conversation that was initially in the panel. We want it to be accessible, and we want it to be usable continuously for even in care deserts across our country as well as other places in the EU. Towards accessing, I'm running over, towards accessing the payers, part of the benefit of having the breakthrough device designation is that there are TSEP programs right now in place for Medicare, and we're hoping that they'll be in place for Medicaid and allow us first access in DRG programs.
Thank you.